NEHAWU in the Eastern Cape has warned the government that should it not put the interest of frontline workers first, it will intensify its actions of downing tools. It has further warned that the health system will collapse if its demands are not met. Reporter Abongile Jantjies spoke to the provincial secretary of NEHAWU.
Very good afternoon to you in studio. We're coming to you in Bisho, where NEHAWU just held a mass demonstration here, marching to the provincial offices of the Office of the Premier to hand over their memorandum of demands. Well, they are saying that they will not back down until their demands are met. In the absence of the Premier, Oscar Mabuyane, the Finance MEC, Mlungi Sumvoko, accepted the demands on his behalf, saying that they will look into the matter. But NEHAWU says they will not back down until their workers have adequate PPEs in the workplace and that all their demands are met, in that their safety is ensured. But to tell us more, I'm now joined by the provincial secretary of NEHAWU here in the Eastern Cape, Mr. Miki Jaceni. Nopala, a very good afternoon to you. We see that you've just come out, you just made your way here to the province's headquarters. What do you hope to achieve with this demonstration?
Thank you. We are here as NEHAWU in our thousands to present the memorandum. And we have already given the MEC who was delegated by the Premier. What we hope to achieve is the full compliance of all the demands that we have tabled today. And failure to comply with such demands will have consequences which will be too ghastly to contemplate, because on the 10th of this month we'll be downing tools forever. And you can see the thousands in the public service that are here today signify that indeed the service delivery will be hampered. And we are so sure that indeed some of these things have happened, but there is a lot that has not been done, especially in corruption and also the provision of PPEs to our members who have died during this COVID-19 pandemic. We are trying by all means to flatten the curve, but we would want compliance with all the OHS regulations that are there. So we are simply saying, if the government is just not listening to us as a NEHAWU, because we are a force to be reckoned, if they don't listen to us, we will do what we have done to other people who were in charge of this country before.
Surely you have lost a number of people due to frontline workers due to COVID-19. An estimate of how many people have you lost, how many frontline workers have lost their lives due to coronavirus here in the province?
In the province, first of all, I must indicate that it is underestimated, because we are talking about the figure that is more than 200. We are, as NEHAWU, we have done our own survey, both in the private sector and also in the public sector. That number is too low. If we can go and dig deeper, you will see that even the laboratories that have not been pronouncing on the infections are still holding the numbers. So we can estimate that many people got infected, but as NEHAWU, we have just held our day of prayer in commemoration of those who have lost us, and we believe that it is a number that we cannot tolerate, because those are family members.
How much has government corruption contributed to your needs not being met?
I can confirm that even the Auditor General report confirms our long view that indeed this corruption that has happened so far have made us to lose millions of rands. Because how do you give a tender of PPE to a man who is washing cars, or just a man that has not been in business, but you give that man a million tender? So the kind of corruption that is there must be rooted out, and we'll make sure that we expose it throughout.
Lastly, the HOD of the Health Department, you were calling for him, Dr. Tobile Mbengashe, to resign finally has resigned. He'll step aside at the end of this month. How does that make you feel? And what's the one thing that really made you to want him to leave?
No, I think let's first appreciate what he has done, because he has done favor for himself. It has been long overdue, his resignation, because we're beginning to organize ourselves and mobilize that we will forcefully remove him. But we hope where he is deployed, he'll do better, because he is a doctor. Maybe the kind of skill and the experience that he has as an advisor of the Premier will also contribute immensely and make this province move forward. But we'll be there to always assess, and we will not keep quiet when he is not doing well. But also we are moving forward to say there are those that are left there. The MEC must also account for some of the things that she has done. We are not leaving any stone unturned, because we are not targeting individuals. We are targeting the system that is corrupt, that is not giving our people the service that they need the most.
So now that he is stepping aside, what kind of person will NEHAWU accept for that vacancy now that he's gone?
We'll accept anyone who has got the requisite skill, who has got the experience, who will take the department forward. And we hope we will be consulted, because many people that have been vetted, we know at least that we will be supporting that person until or such time that he is not or she is not coming to the party. So we'll support anyone. That's the kind of person that we want, somebody with the requisite skills.
I thank you so much for your time, and all the best with your plans.
Thank you.
Well, that was the Secretary of NEHAWU in the Eastern Cape, Miki Jaceni, telling us about their demands and what they hope to achieve with these mass demonstrations here. Well, in the next, they say they've given them the 7 days to fully comply with their demands. After that, they'll down tools for the longest of time. From us here in Bisho, myself, Abongile Jantjies, and my colleague, Funani, it's back to you in studio.